So now we're going to get into the muscles of the back. So we're going to first start with the superficial and intermediate muscles, and then we're also going to have the deep muscles in the next video. So just so you know, the superficial muscles, so for our superficial muscles, we have the trapezius, the Latissimus Dorsi, the Levator Scapulae, and the Rhomboids. There are two rhomboids, the minor and the major. Our intermediate are the serratus posterior superior and the serratus posterior inferior. And then our last group is the deep muscles, which are the erector spinae and the multifidus. So let's start with the superficial muscles. The superficial muscles, the function is pretty much moving the shoulders. And so I've drawn the back out here. This is supposed to be the spinal cord or the vertebrae. This is his shoulder, his arm, and the muscles that we're going to discuss. As well as over here we have the muscles as well. And this right here is a scapula. So let's start with naming that. So we have our acromion right here. We have the superior angle, the spine, this notch that you see right here is the suprascapular notch. And then if we were to have the other side, this right here would be the coronoid process, which is going out towards the back. And right here we have the infraspinous fossa. Now I know that this time I didn't include this picture, it's just because it's a pretty poor drawing, and I'd like to admit that. But in the links section I do have my notes and a quick table that's going to give you everything we cover here, just to make it a little simple for memorization. And so let's go with the superficial muscles. So to begin with, the superficial muscles are the ones that are directly under the skin. So think superficial. If it's on the superficial surface, it's the furthest out. And for the most part, they're going to originate from the vertebral column, and then they're going to attach to different bones. So let's start with the traps. So right here is the skull, and the origin, it's going to come from the external occipital, which is at the base of the skull. And so it's this protuberance that's right at the center. That's where it's going to all start. It's also going to be the fascia that's associated with this area right here. There's something called, specifically right here, where there's the nuchal ligament around this area. The ligamenta nuchae is the fascia that's associated with this area. That's going to also be a point of origin. And then the vertebrae from C7, so right around here, all the way down to T12. So as you see, this big winged thing right here is your trapezius muscle. It's going to go into the clavicle, so lateral 1/3 of the clavicle. So as you guess, it's probably going to be right up here, up towards the top. It's also going to go towards the acromion, so right around here, and the spine. So basically, our traps are going to cover this whole area right here. And the function of the trapezius is it's going to draw the scapula down. So if we think about it, if this is our scapula, if it's raised up by another set of muscles, so we have this turn this way, so basically instead of the scapula being up as though we're raising our arm, it's allowing it to come down. And so there are three functions, I should say. The action of the lower, so the lower trap right here, is going to draw the scapula down. So another way to think of that is if you're pushing your shoulders down, that would be the function of the lower trapezius. Now, if we're looking at the middle, which is right about here, what that's going to do is it's going to adduct the scapula. So if you think about doing cable rows, as you're pulling in, your shoulder blades are going to be pinching towards each other, and that would be the function of the middle trapezius doing that. And lastly, we have the upper trapezius, and that's going to basically move the scapula up. So what that means is if you're lifting your arms above your head, that would be the job of the upper and partially the middle traps. Another thing that another job would be if you wanted to do shoulder shrugs, for instance, where you're lifting your shoulders up to your ears almost. That would be the upper traps, as well as another muscle that we're going to get into, the Levator Scapulae. So basically, this group right here controls lifting your arms up above your head, as well as lifting your shoulders up. Next we have the Latissimus Dorsi, which is right here. So as I said, this area right here is the trap. And just for clarifications, these muscles are on both sides. I just drew on one side so I have the ability to draw on the other side as well. So our lats are the big group that's lower. So if we're working our lower back, we're really working our lats. Our upper back is the traps. So our Latissimus Dorsi, the origin is going to start from T6 to T12, so it's going to be the lower vertebrae. It's also the Thoraco columnar fascia, which is the fascia that's closest towards, for lack of a better way of saying it, your bottom. And it's going to also attach to the iliac crest on your pelvic bone. So that would be like right about here. And it's going to make its way all the way up to the humerus. So it's actually going to come somewhere around here. As it comes in, it's going to attach to the humerus. And as you might guess, it's going to help adduct, extend, and medially rotate your arm. Now, the one thing I forgot to mention about the traps is it's innervated by cranial nerve 10. So this is cranial nerve 10. Oh, sorry, cranial nerve 11, my mistake. And cranial nerve 11 is also known as the spinal accessory nerve. The lats, on the other hand, they're controlled by, or innervated by, the thoracodorsal nerve. So if you think about it, one of the points of origin is the thoracocolumnar fascia. So if you see thoraco, just remember lats. So their origin and their nerve have the word thoraco in it. Next we have the levator scapulae. And the levator scapulae is the muscle that's going to come from the superior angle of the medial border of the scapula. So right around here. So this is our scapula right here. So it's going to start from right about here, or it's going to insert, I should say, from right there, and it's going to go towards the C1 to C4. So it's going to go basically right around here if we're saying this is the occipital bone. So it's going to start from our atlas, go down to our axis, C2 and C3, so basically our neck. And as you might have guessed it, since it's going towards the neck, what its job is going to help elevate and adduct the scapula. And so, kind of thinking back to before, in conjunction with the upper traps, it's going to help lift your shoulders up to your ear. Now we have our rhomboid minor and major. So the minor is here, and these three guys right here are the majors. And you're probably wondering why I didn't talk about what's its innervation. And the reason is the rhomboids and the levator scapulae, they're all innervated by the dorsal scapular nerve, or the DSN. Now the rhomboid muscles, so the minor, as you can tell, it's a little further up, so it's going to be attached to the C7 and T1. The rhomboid major has 3 muscles, and so it's going to be T2 to T5. So just remember, your majors are a little south, so they're going to cover more of the thoracic vertebrae, while the minor is going to be less. The minor is going to attach to the medial border of the scapula. So it's going to be right around here. The major, on the other hand, is going to start at the medial border and make its way towards the inferior border, or the inferior angles. It's going to make its way down. So it's going to really help with that motion and kind of helping with the traps move the scapula and keep that fluid motion. So these smaller muscles are going to help with precision, while the bigger muscles are going to do most of the job. And so both the rhomboids are going to help elevate and adduct the scapula. So just remember, think about it this way. This group right here is controlled by the DSN. They all have the same action where they're going to elevate and adduct the scapula. They're all coming from the scapula. So if you think about it, the levator is higher than the minor than the major, so their insertion is going to be high, medium, or middle, low. And so that's an easy way to remember where the insertions are. Same with their origins. The levator is going to start all the way at the top, then right around the middle we're going to go for the rhomboid minor, and right at the center, or I should say the end of the thoracic, we now have the major. Next we have our first set of intermediate muscles, and our intermediate muscles are a little bit different. Our intermediate muscles are basically like this, and I'm sorry to draw over this picture like this. So if you see a really thin piece of muscle, and it's going to be extremely thin, and when you're doing your cadaver dissection, you're more than likely going to just sever it. So if they're going in an upward direction, so if they're starting low and going high, that's going to be your serratus posterior superior. If it's further south and it's going this way, then that downward angle looking one is a superior serratus posterior inferior, on the other hand. The difference is the serratus posterior superior, it goes from C7, so this is going to go C7 to T2. The inferior version is going to go L4 to L5. So just remember, superior is going to make an A, the inferior makes a V. The function of the superior, or serratus posterior superior, is that it's going to raise the ribs to increase the volume of the thoracic cavity, and it's also involved with proprioception. So both of these muscles, if somebody's asthmatic, they're going to really use these muscles. For the people that aren't asthmatic, they're not going to really have as much of a use for these muscles, but they're going to help with opening your, expanding your ribs so that you can increase air coming into your lungs. The superior version, it's innervated by the intercostal nerves 2 through 5. The inferior is the intercostal nerves 9 through 12. The insertion for the inferior, as you probably guessed it, since it involves the ribs, it's going to be the last 4 ribs. The superior, on the other hand, is going to be the upper 2 through 5 ribs. So just remember, it's upper, it's got to be higher. It's not exactly at the first rib because of the angle. And that's really the big difference between those two. Now, the only thing I didn't mention so far is, what does insertion mean and what is origin? So if I'm at the starting point, it's a fixed point, right? So just remember, the origin is the fixed point. So if you think of our origins, we're always coming from one fixed point. Now our insertion, on the other hand, that's the movable end. And I just realized I spelled that wrong. So just remember, the insertion is the movable end, the origin is the fixed end. Alrighty, that's the first set of the back muscles. Just keep in mind your superficial, your intermediate, and your deep, where everything is. On the next video, I'll try and get a better picture. If you like the video, please hit the thumbs up. If you have any questions, comments, leave it in the caption below. And if you like the channel, please subscribe.